Welcome to the Mizzou Health News Network, your source for information about medical care, education, and research at the University of Missouri. MU's Ellis Fischel Cancer Center celebrated a historic affiliation with the renowned MD Anderson Cancer Network in March. The national network was created to eliminate cancer by collaborating on quality improvement and best practices. Ellis Fischel is the network's first academic certified member.
The groundbreaking collaboration is a perfect example of how the University of Missouri is carrying out our mission of advancing the health of the people of Missouri. The University of Missouri and MD Anderson have a shared long-term goal to eliminate cancer and in the short term reduce the number of deaths caused by cancer.
This is a recognition of the university's commitment to excellence in terms of health care, in this case for cancer in particular. MD Anderson is the #1 cancer center in the world today by most ranking organizations' judgment. And by joining with them, we are bringing that quality of care, that excellence to the University of Missouri and therefore to Missourians in general.
The certified membership is very important to the MD Anderson Cancer Network as it brings together truly great institutions in the aim to eliminate cancer.
This has been mentioned, our first academic affiliation within the member network. And I think that's a unique touch point for us because we see relationships as they move forward branching out beyond just the patient care side, but into research collaborations, training opportunities for our care providers, and so forth.
MU fourth-year medical students gathered for Match Day in March to learn where they will continue their education as resident physicians. 46% of the class of 2014 will stay in Missouri for residency training, 25% will stay at MU, and the rest will continue their education at other leading medical institutions.
I'm going to Cincinnati Children's for pediatrics. It's great news.
You know, there's just a lot of thoughts running through my head right now, but I matched on my first choice, so I'm really excited about that. I'm going to Houston. I matched in Chicago for my transitional year at a place called Resurrection. Really excited to be there. And then for dermatology, I did match in Chicago at the University of Chicago.
Which is awesome because I live in Chicago. I'm doing my residency up there, so we were really hoping that she would match up there. So
I'm thrilled.
Dreams come true.
MU's School of Medicine has once again been recognized as a leader in family medicine by U.S. News & World Report magazine. MU's Family and Community Medicine Department ranked 8th in the magazine's new Best Graduate School edition.
This is the 21st year in a row. I think all the years of available rankings we've been in that top 10 group. And because this is a ranking that is determined by deans and senior leaders in family medicine, it's really sort of a peer review of our department and its contributions nationally. Now, that doesn't mean that we should rest on our success, but rather that we should really strive to ever go forward and really encourages us to excellence in a way that I think has a very positive impact on our department and the way that we relate to other people in the work that we do.
The family medicine program at the University of Missouri is unique for a number of reasons. We have 4 different continuity clinic sites for our residents to see patients in. 2 are rural clinics located 30 miles from the University of Missouri. We also have residents who see patients in a federally qualified health center. We really provide all the wonderful teaching associated with a tertiary care center and a cutting-edge university, but also provide them with the practical laboratory of our rural clinics.
MU Healthcare and Hy-Vee, one of the nation's largest supermarket chains, will open walk-in clinics this summer at stores in Columbia, Missouri. The clinics will provide convenient quality care for common illnesses 7 days a week and link to MU's advanced electronic medical records.
We think people will be seen in these clinics for common everyday health problems. Examples would be rash, sore throat, cough, earache, bladder infection type symptoms, simple things that just need quick, affordable, convenient access.
an MU cardiovascular patient and her sons were surprised with a newly decorated home provided by the Room of Hope program. University patients receive free interior design services through the program sponsored by MU Healthcare.
I've had heart problems for almost 10 years. My heart doctor, Dr. Sullivan from University Hospital, who is an awesome cardiologist, her team put me in for the Room of Hope, and I didn't know him until she called and was like, hey, fill out the application. It makes a huge difference, as you can see from the looks on my kids' face. When they see in the rooms, we really, really appreciate it.
Thank you for making my room awesome.
To learn more about medical care, education, and research at the University of Missouri, visit us on YouTube, Facebook, and Twitter.